So today we're going to be doing a tooth whitening procedure. We're going to be doing both the full upper and lower arch. And for the most part the procedure is really straightforward. The idea is we're going to retract any kind of soft tissue, make sure we don't cause any trouble with that. We're going to put the material directly onto the teeth and then let it do its thing. We typically do 3 sessions of 20 minutes each to try and get the teeth to their lightest. The only side effects we ever look for are sensitivity of the teeth. And real straightforward, just gently placing it on top of the gums. You okay in there, Sharma?
Mm-hmm. Is this a one-time treatment?
That's a good question. Bleaching typically or whitening, the results tend to vary depending on a lot of your own personal habits. The idea with the in-office procedure is that we're using a stronger material, something that's about 38%. So is it a one-time procedure? Well, we usually say that bleaching tends to last anywhere from 1 to 3 years, depending on your habits with food, with smoking, with things like that, anything that can stain your teeth. So not exactly. Most of the time you do want to kind of keep up with it. There are many different ways you can keep up with it. You can do tray bleaching after the fact, or you can just come in and get another session done. The reason why I like the in-office technique is because for people like myself and people who are busy in their personal lives, it's not quite so time consuming. You just come in and get it done. While messing with the trays at home tends to be a little bit more of a pain, more time consuming, a little more messy. You come into the office, we do all the work for you, we keep it pretty neat, and it tends to be the quickest and best results that you can get. The newer material that we're using actually has some fluoride in it, has some potassium nitrate in it, which is similar to the chemical that they use in Sensodyne to prevent sensitivity. Really the only issue you can have with whitening is a little bit of sensitivity after the fact. So we do everything we can to prevent that you maximize your aesthetic result.
Is there anybody who would not be a candidate for this type of whitening?
Again, your results are going to depend on what your teeth look like. Some people have had staining or decalcification from braces. You don't tend to get the best results if you're doing that kind of case. So even though it might be worth the effort to try that, to try to whiten somebody's teeth like that, you want to keep your expectations somewhat realistic.
Okay.
Shayna here's got pretty light teeth to begin with, and she's somebody who I think we're going to get excellent results.
Okay.
The yellower stains tend to come out a little bit better, while the gray and the brown stains tend to take a little bit more effort. And sometimes, like I said, you want to keep your expectations realistic. And the other thing is if you've got a lot of fillings, a lot of restorations, if you've got crowns or veneers, things like that don't tend to whiten. So that's really contraindicated. The whitening procedure is contraindicated in those patients. And that's why when we do things like that, we try to get them as white as possible to begin with, or as white as you're comfortable with, so that you get a nice aesthetic result that'll last.
Okay.
Also, if you have excessive sensitivity, if you're somebody who knows that, well, you already use Sensodyne quite a bit because your teeth tend to get sensitive, well, in that situation, you're probably not the best candidate for something like this where we're using a real strong material. You probably want to consider using something like a 10% take-home where you can get good results. It's just going to take a little bit more time, and we're going to go a little slower with it. Here in the office, we'll put on a movie for you. We can get you some headphones, whatever we have to do to make you comfortable while you're getting the procedure done. So that way, if we want to go a little bit further, we can. Also, we can cut it short. If the patient's starting to get some sensitivity, we can do it in stages as well. If you do one 20-minute session today, we might have you come back and do another one in a few weeks, making sure that you're comfortable the whole time.
Okay.
Because at the end of the day, we never want to compromise any comfort for aesthetic appeal. That's certainly not our mission here. We just want things to look better, but keeping our patients comfortable.